So I've already made the incision on the inside, and now I'm coming down to where fat is at. See that fat there? Well, that's what needs to come out. So today we're going to be performing an upper and a lower blepharoplasty, or upper and lower eyelid surgery. This is how the patient presents. You can see a lot of skin on the upper eyelid, and then puffiness bags are really what it is fat herniation on the lower eyelid area. So on the upper eyelids, we're going to remove skin. On the lower eyelids, we're going to take away fat. The approach for the lower eyelid is going to be an incision that we call transconjunctival. That's going to be inside, so there will be no external incision on the eyelid. And on the upper, of course, we're going to need to remove skin. The incision is going to actually go, like I said, on the inside, what we call the conjunctiva of the eye. So there's not going to be any incision on the outside. And from there, I'm going to go ahead and be able to access fat. So I'll show you that as I go along. So I've already made the incision on the inside, and now I'm coming down to where fat is at. I have to use my headlight for this, or I won't be able to see. So sorry, the light is a little tough. But you can see there, as we're working, here we go. See that fat there? Well, that's what needs to come out. That's what's causing the bulging of the lower eyelid. So I'm going to start removing that and some more fat. There's 3 distinct compartments: the medial, central, and the lateral. And we're going to take fat from all of those. Here's the fat removed from the right side, as you can see. And then you can see how much that's helped with the puffiness here. So I'm going to go over to the other side and do the same, and then we'll address the upper eyelid. So here's the fat that's been removed from both sides. So we're going to go ahead and now talk about doing the upper. So I have marked out for an ellipsis skin that's going to be removed. And this, instead of removing fat, is primarily skin only. I may remove a little bit of fat immediately, but this on the upper, it's a different ball game. This is really the game. The plan is to remove skin only and possibly a little bit of fat. Okay, so here's the incision completed. So that ellipsis skin I'm going to go ahead and remove, and then I'll show you once we get to that point. Okay, here's the strip of skin that's been removed. So now you can see what's going to happen there. I'm going to remove a tiny bit of fat from right here, and then I'm going to start closing this to there. Okay, so this is a little bit of fat that I removed. I usually only remove it from the medial fat compartment, because I don't want to skeletonize the eyes. So we're already pretty much done with this upper eyelid. We just need to close. We're all done. So you can see here the skin and the fat that came out. This was also a little lesion that was right there that we took out as well. So just to reiterate, on the lower eyelids, it was a incision that went inside the eyelid and the fat came out. And the reason that we do that is not just because there's not an external scar, but it helps preserve the retractors, or the things that keep the eyelid taut to the eyeball, so that you don't have an ectropion or drooping of the eyelid later. Now on the upper, it's a skin removal and a little bit of fat right there. Okay, so that's a procedure. It was done under local anesthesia with oral sedation and oral analgesia. Here in the office, I'm Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso. If you like what you see, become a subscriber so you can see all the latest content.